Otis Brewster. I'm 23 years old, African-American male, out of San Francisco, California, Southeast Community Center, Southeast, which is Hunters Point. And we're here at the Armory, where I just got a free dental pull-in for real, you know what I'm saying, oral exam and things, and I really appreciate what they doing for us because, you know, the healthcare thing, you know, that's just the healthcare thing within itself, but it takes people like this to come to the community and show that people really do care. So, you know, that's just a big thing. They got big hearts and they just pouring out their hearts to us right now. We all appreciate that. I know I do, and the person that I brought to definitely appreciate it. So, you know, it's just a good thing to endure, to see people that's doing the right thing and that want to help, you know. So yeah, that's definitely basically two thumbs.
Okay, that's it. How'd you do? Survivable?
It's right behind you.
Oh, praise God. Well, let's pray that we get some meeting from that, okay?
My name is Vasa Laupati. I'm with New Start Global in Health, and we are here in San Francisco for ASI doing this huge health outreach. Now, New Start Global, what we do is we train people for medical evangelism or medical mission workers. Today, our health students and New Start Global are here and just sharing the different aspects of the New Start acronym, which stands for nutrition, exercise, water, sunlight, temperance, air, rest, and trust in God. We're showing people that if we can help to change up their lifestyle, it'll help them become better.
My name is Alice Merrill, and I am from Northern California Conference. I do children's ministry and family ministry there, and I'm helping here at this event in the children's division part. We're running a mini health expo, teaching the children about the 8 basic areas of health that we're trying to also teach the adults. And as they enter, they go to one of 8 different stations and are taught a little bit of brain work, and then they do an activity that helps them to learn how to incorporate that into their life. And so they go from station to station, spend about 15 to 20 minutes at each area, and then they're given a certificate at the end to show that they have learned how to do all of those things. And they seem to enjoy it. It gives them a little bit of physical activity and a little bit of brain work, and occupies the time when their parents are getting some medical or dental help. And the program is going very well.
My name is Michael Tuazon, and I'm the director of Souls West, which is the evangelism school of the Pacific Union Conference. They assigned me in the chaplaincy department, and what we do is we are the last station, and whenever someone receives treatment, they have paperwork. They go to our station to get the paperwork copied. They get their bands cut off, showing that they are now leaving and exiting the building. And then they receive a care package. In the care package, we offer toiletries, we offer a toothbrush, toothpaste, conditioner, shampoo, soap, some of the basics and essentials. But what I'm excited about is I can tell them that we are their friends, the Seventh-day Adventist Church, and that we have future events for them that they can look forward to. We also offer a Steps to Christ, a ministry of healing, and something for them practically, physically, that they can also follow. We then ask them if they would like prayer, and we have a couple of prayer booths that they can come and sit down and receive prayer. And during this time, this is the best part of the day. This is when they open up, they tell us about their personal issues and struggles. We get to share the Bible with them, and afterwards, we escort them outside, and many of them have said that they would be back for all 3 days, that they would come back not just today, but they'll be back tomorrow because they can only receive 1 or 2 treatments per day.
My name is Tony. Steiner Jefferson. Well, what's bringing me here today is dental. I want to check up on my teeth. It means a lot because I didn't have any other way of getting my teeth checked and maybe get crowns because there's no dental here in San Francisco for Medi-Cal. There's no dental, so it's a good thing. I enjoyed you guys' little bag lunch. That was good because I did get hungry, and the sandwich was good. I still got some of the water. And the literature, I got some literature, and that was good. The people have been nice, very nice. Keep up the good work. And thank you so much for your time. That's the most important thing. Thank the volunteers for their time. Because otherwise, you know, I mean, they got like hundreds of people here for this. So I'm volunteering to help out. So yeah, I thank the volunteers. And I hope maybe one time I could be one. Next time, maybe.
Hi, my name is Randy Bivens, and I'm a radiologist, and we have been asked to provide imaging services here now in a portable situation, which is what we have here. We're somewhat limited, but General Electric has provided us with a very new cutting-edge digital machine here, and in reality, the images are looking almost as good as if we were in a room, in a full-fitted room in a hospital. And this is a lot better than any portable x-ray machine films I've ever seen. So the quality is it's cutting edge, and it's just as good as if you were in a hospital. And we're reading them real-time, handwriting and interpretation. We're actually producing a CD, which the reading software and the images are put onto the CD. We hand it to the patient. So if they go back and see their regular doctor, if they go to the emergency room and they go, I had an x-ray like a week ago, in fact, here it is. It's all taken care of. The patients are excited to have it. We can move them through rapidly, and it really provides us a benefit, especially in orthopedics and in cardiology. We do chest x-rays and extremity films a lot. We've done a lot of lumbar spines and abdominal films looking for kidney stones. It really is great to have this valuable tool as an adjunct to taking care of people here.
Well, welcome. Thank you so much. I'm Dr. Leela Lewis. I'm the president of Pacific Union ASI, and we are so excited to have been able to put on Bridges to Health in conjunction with the Seventh-day Adventist Church, the Pacific Union Conference of Seventh-day Adventists, as well as the Northern and Central California conferences. And what Bridges to Health is for the last 3 days, 2 days in San Francisco and 1 day in Oakland, we were able to provide free medical, dental, and eye care services to what we estimate was just about 3,000 people. Today we just finished Oakland, and we had more than 3,500 people at 7 o'clock in the morning when we first showed up. We were able to service just over 1,000 of those today, so we are praising and thanking God. Of those 1,000 people, actually we were able to give them 4 to 5 services per person, which actually totals more than what we were estimating, probably closer to $4.2+ million of free medical, dental, and eye care services. But more important than that, we presented God's whole person care physical, mental, and spiritual health. You know, we're Seventh-day Adventists, and we believe in whole person care. And then when you break the triad of health, there is not perfect health, and each one of them contributes to the other. So we were so blessed to be able to have Weimar Academy, multiple different lifestyle individuals purporting how they can make simple dietary and lifestyle changes to not just prevent disease, but in many cases even help to reverse diabetes and other problems. In working with the physicians, we've seen amazing results, and so we are just praising the Lord for that. We also had the opportunity of working with many chaplains in chaplaincy services, again, meeting the spiritual needs of the patients. So I just want to say personally, this has been an amazing, amazing experience for myself. After a year of planning with our team, it's not myself alone. We've had a whole team of people working together. And over the last year, we have seen God do absolute miracles. And so I just want to say thank you to God for everything that He has done. Thank you to all of our volunteers, and specifically thank you to our department heads. But again, most importantly, thank you to Jesus for allowing us to participate with Him, to be His hands ministering for those most in need.
You know, the question, and I've been asked this by a number of people, who are you guys and why are you here? And I actually had a conversation with a patient just a few minutes ago, and I said, you know, he has a really interesting question, but I said, I am a Christian, and I believe that Jesus has asked us to deliver to the poor, to the needy, to everyone without barrier. And I said, the truth is when I get involved in these kind of ministries, I really see in the patient's face, I see the face of Jesus. And when I told her that, she had tears in her eyes. And she said, I have today seen the face of Jesus.
What I've also noticed is that many people who we talk to have not heard of the Seventh-day Adventist Church. So to be able to tell them about the Adventist Church in a friendly, non-pushy way is something that I really look forward to. Because a lot of times, whenever we canvass or whenever we go door to door or whenever we do an evangelistic series, some people feel pressured. But to be able to talk about our church in a way where they've received medical treatment has really meant a lot to me, to be able to see our church at the forefront of something as big as this in the city of San Francisco.
I have never been involved in anything like this before, so it's been a huge learning curve. It's been very exciting to see so many people blessed by this. It's been wonderful to feel like that even though I'm not physically helping somebody get better or to go away from here with a new tooth or something or a cavity filled or whatever, in some way we're helping them. We're taking care of their children so that they can feel secure, that they don't have to worry about that while the parents are getting some help. So we feel good that we're being able to in some way help in the overall program.
This was definitely a big deal. Definitely, I've been out here since last night, 9:30. I'm talking about this is serious. This is not a game for real. It was people in front of me, like 5 people. But I definitely made sure I got here 9:30. I've been out here all night waiting for this for real. Serious. Definitely gonna help spread the word. I'm gonna try to get somebody's number and possibly volunteer when they got another time I could volunteer. I might be here tomorrow too. Spend the night again. Like I was saying, yeah, definitely get somebody's number and volunteer, just because I feel what they doing and I'm like, damn, that's so right on. Like, they just make you want to be a part of it just because, like, you see they doing the right thing. So it's like, I want to do the right thing too. Hold on, wait, don't leave me out. So yeah, it's just all a blessing for real. That's how I feel right now. It's a blessing. Sorry if I'm just kind of, my mouth a little, but they, you know what I'm saying?
Spirit of Prophecy speaks about the health message, that this is the entering wedge. And in my own personal experience, I found that in trying to just reach out to people and inviting them to Bible studies, if you're going door to door, you don't get a good enough of a response. Whereas when you do something like this, when you're meeting the needs of the people in regards to health, it's very important. This is something really big for us, because now not only will people see that we're meeting the needs, but believers, Christians will see that they can do this. I myself, I have no medical background whatsoever. But from the training that I receive, I'm able to do this. I'm able to talk to people about things as simple as eat this and you'll feel better. Stay away from this, you'll feel better. Sleep this much and you'll feel better.